Hey everyone, welcome back to my channel. It's Dr. Alessandro. In today's video, I'm actually going to be talking with you about, you could call it dental fear or anxiety. So I know a lot of people have it and they express it in different ways or try to be stoic and not express it. But what I want to tell you is that it's perfectly okay to be nervous, anxious, or maybe even scared of the dentist. And the reason why I say it's perfectly okay is because when I was growing up, I was afraid of the dentist too. So maybe it's for different reasons than a lot of people. But my own experience was we used to have to chew these disclosing tablets that turned everything pink in the mouth if you didn't brush that spot. Well, I thought I'd brushed really well when I was 6 years old. I went to the pediatric dentist and I thought I'd given it a good scrub. I'm 6 years old. I'm trying to brush and oh yeah, I must have done awesome. Then when they gave me a tablet, told me to chew it and then spit it out and look in a mirror, I found that I had not done so awesome. And my whole mouth was basically still pink. So from that point on, I was determined to brush all those cavity bugs out of my mouth, and I became a really avid toothbrusher because of that. So that kind of concern that I could get cavities if I didn't brush, or that kind of really fear, is what inspired me to be a really good brusher, but then it became bad because I became a really good scrubber, which is not how you should brush your teeth. So that was part of it. The other part of my dental anxiety really came from, the medical side of the house. Getting immunizations means you have to get shots, getting your vaccine, just like we're all going to be getting our COVID vaccine as time goes on. I never liked shots. Of course, they never felt really good. And so I was always trying to keep my mouth clean and avoid cavities so that I didn't have to get a shot or a needle for any kind of dental care. And so just the fear of the needle kind of kept me keeping things clean. But I'll tell you what, the fear of the needle also kept me from getting injections for when I had dental work done. I had a baby tooth extracted because it broke. And the fear of the needle is what kept me from getting numb for an extraction. And I can still remember the extraction. It was not that pleasant. So the fear of the needle can be something that's really powerful. And it kept me from getting numb when I had 2 fillings done because I was afraid, even up until I was about age 22. Being afraid of the needle kept me from getting any kind of Novocaine for 2 different fillings, and I felt them. So I know what dental discomfort is like because I have felt it from the drill and from having a tooth extracted with no Novocaine. And at a certain point, I had to get over it. When I went to dental school, all of us in our class and all dental students have to get each other numb. That is, they have to participate in a session where we give Novocaine to one another and we get each other numb to get the experience. So that was my very first dental numbness experience, was from a classmate who will remain nameless, but who never came to class, but yet gave me my very first injection. So I did a good job too, but was one that really didn't come to class. So there was a little bit of anxiety there, but he did a good job and he got me numb. And so after that, I got numb for a few other experiences, such as another filling that I had to have done, and even my wisdom teeth, I got numb for that. I was awake for that, but I got numb for that, and I had my wisdom teeth taken out. So all in all, what I want you all to know is that it's perfectly okay to be nervous, and perfectly okay to be anxious and scared. It's totally normal. I get it. And I personally try to do everything I humanly possibly can to make things as comfortable and easy as they can be in the chair. And I will always do that, and I'm sure that a lot of my colleagues, strive to do the same thing. So if you're nervous or scared, please let us know. Don't keep it in. Just let us know, and please let us know whatever we can do to make things easier for you, because we know it's tough. I certainly do. From my own experiences, I know it's tough, and I don't want it to be tough, or at least I want to make it as easy and good as it can be for you all. So that's it. Thank you so much for joining me. Hope you're all staying well and healthy, and see you next time.